Good afternoon, everyone. My name is Jeff. Thanks for tuning in to our webinar today, Privacy Breaches in Healthcare, the 2019 report. We're going to go through some interesting changes in privacy breaches, in some of the technology that's causing them, such as ransomware, that sort of thing, and look at the trends and of course provide you some tips on what you can do to protect yourself, your clinic, and your patients. I'll be sort of emceeing things today as the moderator, but for the most part, we're going to be hearing from Rohit Joshi and Ingrid Rice. So just a quick bit about them. So Rohit is a CEO and co-founder of BrightSquid. He is a lawyer with a couple of decades experience as a senior executive in life sciences and technology companies. He's very well versed and deep into privacy compliance regulations across North America. And Ingrid Rice, of course, also very well versed in that sort of thing with 3 decades of working in privacy compliance with clinics and healthcare organizations across Canada and North America, working and establishing some of the regulations and some of the major privacy compliance projects that have really come through in the last number of years. So we'll look quickly at our agenda. So we're going to talk about, first of all, what is a breach? So define what you need to be looking for a breach. And this is important because in many jurisdictions across North America, I know we've got people tuned in from everywhere across Canada and the US, there is mandatory breach reporting in place. So you have to notify patients, you have to notify, whoever the privacy commissioner is in your jurisdiction, many times the government as well, so the health minister, such as in Alberta, notify them of a breach so that proper precautions can be taken. In some cases that might inform regulation changes, that sort of thing, if breaches are happening in a way that wasn't anticipated. So we'll look at the size of the problem. We'll look at why healthcare is vulnerable, and healthcare is particularly vulnerable and particularly targeted. We'll look at different types of breaches. We'll look at some case studies, some common ones, and some new developments in what we're seeing around the world in how breaches are happening. One particular threat alert that's really important that's coming up that needs to be addressed in the next couple months. I think we have less than 2 months now to address that, actually. And what to do moving forward. And of course, the fun part at the end when we get to look at the winners of the draw. So I'm going to turn things over to Ingrid to talk about what is a privacy breach.
Well, thank you, Jeff. So first of all, what is a privacy breach? So a privacy breach involves the improper or unauthorized collection, use, or disclosure, or retention, or disposal of health information or personal information. So, for example, breaches may occur from errors or malicious actions, let's say by clinic staff, very common, cyber criminals, also quite common, or third parties. So it doesn't necessarily have to be by the physician or the custodian themselves. It could be by staff members. The end result is if there's any collection, use, disclosure, retention, or disposal of personal information that is improperly accessed, it is deemed a breach.
Okay, yeah. Fairly straightforward, really. And then just to talk about recent breaches and what's happening, Rohit, do you want to weigh in on this? And
absolutely. You know, one of the challenges that we see regularly is that a lot of times people are looking at ransomware and thinking it may be someone else's problem, or in fact, you know, the more of the reality is that we're involved with, you know, multiple clinics that are trying to recover from ransomware breaches. And honestly, it's a part of our headlines. We're seeing it every day in various parts of the world. This isn't something that's limited to a health clinic. There's you know, full cities. There's full health systems. The NHS breach a few years ago in England. We're seeing hospitals brought down. And we'll go into some of these in details, but I think, you know, it's valuable to talk about how pervasive this issue is. One quick thing, though, before I go on, just as a point of note, you know, we do try to do these webinars monthly. I think this is the first time that Ingrid, myself, and Jeff are in 3 different locations. You know, I think this internet thing is going to catch on, but there are risks.
Yeah, definitely. So let's look at the size of the problem. Ron, do you want to talk about what's happening with that?
Yeah, and you know, honestly, there's lots of lots of data here. The one that sticks out is, you know, the 100% of web applications and 100% of organizations, and there's lots of discussion about how much money this is going to cost, how much time it's going to consume, but the fact is it's happening more, and it's happening more often. So right now, I think in the past year and a half, our team has dealt with the recovery of about 12 or 15 clinics, and that's just in our kind of geography. We have a couple of clinics in the U.S. that have been entirely disrupted because of it as well. And so, you know, the fact that they're going to quadruple by 2020 is certainly frightening. I think this is a money-making business for cyber criminals, and one of them that is paying off. And that's why it continues to attract new ransom innovations. And we'll talk about some of the specific cases coming up. But you know, the purpose of this slide is not to scare you. It is to let you know that unless you are protective and proactive, expect to get hit, and that's the real challenge.
Yeah, and I think just one other thing to mention here is that, look, if you look at reports from the Alberta Privacy Commissioner and the Canadian Privacy Commissioner, who both instituted mandatory breach reporting last year in 2018, they've both come out saying they were surprised at the volume of breach reports that came in. They didn't expect to get nearly as many as they do. So even, you know, looking at the problem before they were trying to fix things with breach reporting, we weren't even aware of how bad it was, and now we're starting to see that.
Yeah, and I think just some statistics around that, and this is all breach reporting, not necessarily ransomware breach reporting, but in Alberta, in the province where we're headquartered, we saw an increase of about 400% in terms of ransomware, in terms of breach reporting. Really is an indication again of the size of the problem.
Yeah. And then, Ro, do you want to talk about why healthcare is particularly vulnerable?
Yeah, and I think it's a combination of factors. You know, first of all, the reality is that it affects all clinics, you know, large and small, and in our tours, what we tend to hear is that the smaller clinics feel a little safer, believing that they're not going to be the subject of a hack, where in reality they're probably more vulnerable to an attack because they don't necessarily have full-time IT staff that are making sure. And so the first thing that's important here is that all healthcare organizations are at risk. The second big point here is that the patient information itself is very valuable. You know, if you think of, you know, losing your credit card, well, first of all, the bank's going to protect you, and secondly, you can get a new credit card. When it comes to health data, though, it goes very deep, and it actually enables identity theft, which, if you think about it, allows someone else to take that information and apply for a credit card in your name. And that's where it becomes more valuable than a simple credit card. The other parts of it, and this is, you know, something that we've noticed in terms of working in the healthcare in North America, staff don't often receive the training that they need to recognize and avoid risks. And we've been doing our part. I think we've trained a few thousand people. Apart from these webinars, we've trained a few thousand people now in live classes about ransomware, how to recognize the risks, and how to avoid them. And ultimately, you know, hackers are going to be ahead. You know, it's one of those things where the hackers realize in order to make sure that they're going to continue to make money at this, they're going to be ahead. So we're going to see, I suspect, you know, and I don't need to be a psychic to say this, hacker attacks are going to increase in frequency over the next few years. I think because personal records are of high value, because it's a cat and mouse game in terms of trying to stay ahead of the technology, I think we should expect it. And I think we have a duty really in our type of an organization to help practices prepare for it.
Yeah. So looking at the types of breaches that are happening, Ingrid, can you touch on this and what's happening and how these things are coming about?
Oh, for sure. I love this one. So this graph represents the actual reporting types of breaches that were reported. As you can see, unauthorized access is the majority of the breaches that have come in. So for example, employee snooping, social engineering, that type of breaches. However, you see the little slim theft area. So what's misleading about that is unauthorized access is 90% of the time somebody looking up a sister, a relative, a neighbor. So the amount of harm that is done by that is minimal. It doesn't mean it's negated and not counted. It's absolutely a breach. However, when a theft occurs, such as cybercrime or theft of computers, the amount of information that is stolen is actually immense. And that's why this chart is misleading, accurate nonetheless, but misleading. Same as accidental disclosure, giving out the wrong document, well, you're affecting a low number of people. However, if you lose your computer or your storage drive, even though that's a small percentage, that actually contains a fair amount of information that is now disclosed. So, truth be told, this is accurate. On the other hand, it's a bit misleading.
Yeah, and with respect to this, Ingrid, I looked at this graph. It was really interesting to me because the theft component 5 years ago when I used to give this lecture was much larger then. And so it's starting to, I think, we're starting to see the value and the challenge of connected systems through unauthorized access. You know, it's more than just losing your physical computer or your documents now. In part because of connectivity, we start to see unauthorized access becoming a much bigger part of it. When I was looking at this slide, though, what's interesting, Ingrid, is and Jeff, I'm not sure where I'd put ransomware just based on that categorization. You know, I wonder if that's under unauthorized access or if that comes up from loss. I'm not sure where we would put it on this one.
Yeah, it technically fits into three categories: theft, loss, and unauthorized access. So
right.
It's kind of in that a little of everything.
Yeah, and depending on how this graph was created, we might have seen them put it into unauthorized access, which is the other reason I think it might look as big as it is.
Yeah.
Yeah.
Yeah. I mean, unauthorized access is it's almost a catch-all, right? Because it is such a big part of breaches. So it could be any number of things, but the point is, I think, like you said, Ingrid, that the number of breaches or the depending on what type of breach it is, like ransomware, for example, that does breach all of your records, is really the big problem, and some of these things might not be so big, but we need to protect it from all of them. Let's look at a couple of case studies now. So this is a clinic. This was in the U.S. And it was an ENT, so a specialist in a hearing clinic. They came in one day. I think they came back from vacation and realized that at some point someone had clicked on something they shouldn't have, and all of their computers were locked up. And what they decided to do, rather than pay the ransom or try and remediate anything, they actually just shut down the clinic on the spot. So Ingrid and Rode, can you talk about the implications of that and how that's even possible, or what a clinic's actual responsibilities are in a case like this?
Yeah, let me start, Ingrid, and then you I know you've got some more details around this, but there's a couple of things that are interesting about this. The first is $6,500 seems to be a reasonably average ransom that we're seeing as well. I think the one that the closest one that we're connected to would be the ransom was about $58,000, and that had to do with just the sheer amount of data that was captured by that hacker. But typically, if we're looking at single clinics, we're finding that it's between $6,000 and $10,000, and so I think that number makes sense. The part of it that's more confusing for me in this particular example is that instead of paying the ransom, the clinic shut down. And I wonder, you know, the only way that makes sense to me is maybe the clinic wasn't that successful anyways. You know, I think that if it's $6,500 that's keeping you from operating your clinic, you probably want to do other things. The challenge that I've got is it simply doesn't tell the full story. You can't simply shut down a clinic and hold, patient records, just not have them available. Excuse me. So Ingrid, I'd be interested in kind of your thoughts around how do you sort of close the file even in terms of this, where the clinic may not have access to the data, but now they haven't disposed of it correctly either.
No, and technically there's another violation here, because you cannot just shut down a clinic. It's just not reality. You must notify all your patients. You must advise them all. There's a whole process to follow. So, albeit in this case, this is what they chose to do, it was not the end of the story, and then they will still have to follow up with this. And this scenario has also happened in other provinces. Admittedly more so relevant in the US to shut down, but for up in Canada, we cannot just close down a clinic. We actually have due diligence to follow, and then you will be followed up by your own professional organization to follow that procedures and processes as well. So it's just not reality to shut down.
I'm with you on that, and like I said, I mean, we've dealt with many clinics. One of the US groups that we were working with, their costs of recovery of 5 clinics was over $500,000. And they decided not to shut down, in part because it's not like there are 0 shutdown costs. And so I think that this is very much a little sliver in time, but I don't think it's the full story. It's an interesting one, though.
Yeah, I mean, and the real point is prevention, right? I mean, once it happens, it's too late, and there's no getting out of it. And you can't just walk away. So this is there's a lot of cases like this, and hospitals are getting hit all around the world. We saw with WannaCry in 2017, NHS in the UK, it was decimated. ER departments couldn't function properly. They had to go back to paper in a lot of cases, and that was very difficult. But there's a lot of research into what's happening now, and looking at the repercussions of ransomware attacks. And there's studies now that say that recovering from a ransomware attack and the steps that had to be taken to do that is actually damaging care. So there's long-term impacts of having this happen in the first place.
And I think this is, I think, Jeff, just to follow up, I think this is something that we're going to see more of. And this again is a sign of the times. In order to do this type of study, you actually have to have enough data from enough sources to understand what the impact is on health, and that's where we're at. There were enough hospitals that had been hit by ransomware that they've actually been able to calculate the increase in deaths based on hospitals that are unable to respond in a timely manner to their patients. And it's an unbelievable statistic, not because I don't believe it to be true, but because this is no longer an academic exercise. It's no longer an exercise where we just have to pay a little money, and I know it's inconvenient, but we're going to be down for a day. It's actually affecting the health of patients. And like I said, I think this is the first time that there's been a study that's able to quantify this type of effect on patient health. I'm also sure that it's not going to be the last.
Yeah, it's becoming a bigger and bigger problem, as we've seen.
Right, and it's a good segue into the next slide as well.
Yeah. Yeah, so what's happening with Microsoft, if you're not aware, Windows 7 is end of support. So Microsoft will no longer do software updates or patches from a security standpoint or functionality standpoint. They will not offer any level of support for Windows 7 users. So any clinics, any healthcare organizations that are still using Windows 7 as their operating system on their computers needs to switch before January 14th onto something else like Windows 10 to be secure and protected, because otherwise, once a vulnerability is discovered by the cyber criminals, it will not be closed.
think there's a couple of things around this, Jeff, that are worth mentioning. The first is, all of us are, at Bright Squid, we're all pretty technology up to date. We're pretty technology savvy. All of our stuff gets updated on a regular basis. So when I first saw this slide, I thought, how many people are really still using Windows 7? But of course, the large health systems, it takes thousands, if not millions of dollars to change over all the systems. The reason this becomes relevant, and I think, Ingrid, you foreshadowed it, is embedded in some of the medical devices. So these are medical devices that have been around for many years. It takes many, many years to get through certification processes with the FDA and Health Canada. And once they have something that's working, they leave it. And this is where we've got a problem, where we've got the devices that are operating health systems and health systems that are no longer able to keep up with the cyber attacks. And that's where there is a concern. So if you're a part of a large organization or a small organization that's continuing to use Windows 7 or has devices that use Windows 7, like medical devices that use Windows 7, there is a massive warning here for you. This is now many years in the making. They've extended the deadline at least twice, from my recollection, but I think this time they mean it. I don't think Windows 7 can continue to operate.
No, and the cost of upgrading all these systems, albeit immense, is still better than the vulnerability that you would be exposed to by not updating. So it just doesn't make sense, but then neither does keeping a fax machine. We thought that technology would be out 20 years ago, and yet it's still somehow still around. So the key to this is you have to stay current.
Good point.
Yep. Yeah, and then it comes back to an important point about updating all of your software on a regular basis. Any patch notification that you get, hey, it's time to update this software, likely has some element of a security component to it that is in response to either a discovered vulnerability or a known threat or an anticipated threat. So it is important to make sure that everything you're using in the digital space is up to date. So what can you do moving forward? Because that's really, we talk a lot about the problem, but we need to have some solutions. So the big important thing to do here is understand your privacy risk. If you're on Windows 7, you need to know that you're on Windows 7. And like Rohit said, are there any devices you might not think about that are using that? We have a tool you can use. It's a privacy risk assessment. The link is down there at the bottom. brightsquid.com/pages/privacy risk assessment. It's a quick, I think there's 9 or 10 questions on there that just kind of help do a health check on your level of privacy compliance preparedness and the security of your clinic. You'll get a score, and you can review it with one of our privacy team here at Bright Squid, just to kind of get a sense of where you're at, what steps you should take to be more secure and protect the privacy in your clinic.
Hey, Jeff, just as a quick comment, maybe in the follow-up email after the webinar, we can just send people a link to that so that they've got it there, they can fill it out.
Yeah, absolutely. And Ingrid, I mean, you can talk about this more anyway because you've done so much training, but really training is so important.
Yeah, it is. So it's a privacy impact assessment absolutely is an essential step in doing your due diligence. But the truth be told, not your whole staff is going to sit and read page to page of a privacy impact assessment. Your best bang for your buck is always privacy training, because then you can ask the one-on-one questions. You can go through scenarios. You can actually see and put in real time and real terms what it means to your clinic or to yourselves or to your practice. What does this mean? So absolutely, regular privacy training is very crucial. It also keeps you current on all your information. So, you know, what the latest cyber attacks are looking like, what the newest trending is in privacy. So education, training, absolutely the best step in breach prevention. You know, once staff understand how to avoid these ransomware attacks, it's a huge benefit. And it prevents, let's say, even if it prevented, 2 attacks a day in your clinic, that's still worth it. As you know, so handling patient information, are you handling it properly? Are you disposing of it properly? Is it exposed? Are you talking about it in the staff room? Oh, did you see so-and-so? And did you see the latest information on, you've got to be very cognizant of that. And without that training, people actually don't give it a second thought, or in coffee shops, even worse. And then also have a plan in place. So if a breach were to happen, do you have the steps in place to manage that? And that includes having somebody in as a backup. So if you're away or your privacy officer's away and a breach occurs, you can't always phone somebody that might be in the Bahamas or wherever. You need a plan in place that if A is gone, B can take over, or here are the steps that we need to follow. And because nobody's indispensable, and you need to have all this organized prior to a breach, not after a breach and scrambling to figure it out.
Yeah.
I'm sure you have comments, Rohit.
I did, but I was on mute. I think I might have saved you.
Oh, good.
No, I just fully endorse it. I mean, we've like I said, I mean, I think, Ingrid, between you and I and Bright Squid, we've trained at least a couple of thousand people over the past 18 months, and I see the classes getting bigger and bigger. This is the best defense that a clinic can have. So if you're in the neighborhood, I would love to train you, or sign up for other training systems. In fact, in the feedback form, it might be worth you just mentioning, if you'd like some training, to mention that in the feedback form. One of the things that Ingrid and I and our team is looking at now is, can we deliver proper online training, not just half-an-hour webinars, but proper online training? And how do we do that best? And we do believe the best way is through live training. But if you leave a feedback and say that you'd be interested, we'll see what we can do.
Yeah. So just want to say one other thing about what you can do. Make sure that you're not using regular email to send patient information. Here's just kind of a picture of what email looks like, and any dotted line in here is a vulnerability. The way the email travels across the internet, once it leaves your internal email server or your internet service provider, it's vulnerable. And the big challenge with email is that we don't know where it's going. All of these little servers in between here, we don't know which ones it's hitting. We don't know who's grabbing that information. We don't know how it's being stored. So it's really important not to. And as I think we mentioned earlier, email is the #1 way that ransomware gets into clinics. So even using it from an inbound perspective, not just sending it, is a risk. So think about how you're using email. Think about how it's connected into your network. Ideally, make sure that you're not using email on a computer that is connected to your patient information and your records. And that's something you'd want to talk to your IT about. But that's really sort of best case. And with that, so we have time for questions. If we do, you can put them in the sidebar there. If you have any questions, pop them in, or certainly you can email us in response. I know we're getting close to time, but I want to get through the winners. So the first winner, the most secure messages sent in our audience today is Tessa. So congratulations to that. We'll be sending you a gift card. And Rick is most secure mail invites. So using your secure mail account, you can always invite other clinics and any patients that you need to communicate with as well. And just for showing up, Michelle is the winner for that. So each one of you will be sent a $25 Amazon gift card. So thanks so much for participating. I think we might have time for one quick question if we have any. But I think, yeah, it looks like it's going to be too complex. But if you have anything, certainly email us. We'll send out the webinar recording so you can share it with the rest of your colleagues. And thanks so much for tuning in. Any other final comments?
Oh, thanks everyone. Please let us know if we can continue these webinars, whether or not you find them valuable, or more specifically, if there's something that you'd like us to talk about, a topic that you didn't see covered, let us know.
Okay, perfect. And yeah, just as a reminder, we'll send out the link but make sure you are looking at how you're managing patient information. As Ingrid said, collection use disclosure is so important to make sure that that you're protected and safe.
Perfect. Thank you.
Thanks, Yvonne.